Do you know what diseases can be transmitted from dogs to humans? It might surprise you. We love our dogs, but it's crucial to understand the potential risks associated with pet ownership. From bacterial infections to parasites and even rabies, our furry friends could inadvertently pass on a host of diseases. But don't worry. With the right knowledge and precautions, these risks can be effectively managed. So let's explore this topic and help keep both you and your four-legged family members healthy. Let's dive into the specifics, shall we? Firstly, it's important to understand who is most at risk. While all of us could potentially be exposed to infections from dogs, there are certain groups that need to exercise extra caution. Those with weakened immune systems, including those living with autoimmune diseases or undergoing treatments such as chemotherapy, are at a higher risk. The elderly, whose immune systems may not be as robust, are also more susceptible. Young children, too, are a vulnerable group. Their immune systems are still developing, and they may not understand the importance of hygiene measures such as washing hands after playing with dogs. Additionally, their natural curiosity and closeness to the ground often put them in direct contact with potential sources of infection. It's also worth noting that people who work with dogs, like veterinarians and pet groomers, are more likely to come into contact with these infections due to their increased exposure. Being aware of these risks is the first step in prevention. Now let's talk about dog bites. They're not only painful but can pose a potential risk of infection. When a dog's teeth break the skin, bacteria from the dog's mouth can enter the body, leading to infection. In some cases, this can even result in diseases like tetanus, or in rare instances, rabies. So what should you do if you're bitten? First, clean the wound immediately. Use warm water and soap to thoroughly clean the area. Then apply an antibiotic ointment and cover it with a clean bandage. If the bite is deep or the dog is unfamiliar, it's important to seek medical attention as soon as possible. Further, if the dog appears sick or behaves unusually, or if you don't know its rabies vaccination status, do seek medical help immediately. And of course, report the bite to local animal control or law enforcement. Remember, immediate action is crucial when dealing with dog bites. Bacterial infections are another concern. They can be a little sneaky because they often go unnoticed until they start causing problems. Let's talk about two common bacterial infections that can be transmitted from dogs to humans: Campylobacteriosis and leptospirosis. Campylobacteriosis is an infection caused by Campylobacter bacteria. These bacteria are often found in the intestines of dogs and can contaminate their feces. Here's the sneaky part: you can get the infection if you touch your dog's feces and then touch your mouth. Sounds unpleasant, right? Well, the good news is this is easily preventable. By washing your hands thoroughly after handling your dog's waste, you can significantly reduce the risk of Campylobacteriosis. Moving on to leptospirosis, a rather tricky one, caused by Leptospira bacteria. Dogs can get infected if they come in contact with the urine of an infected animal, often through contaminated water sources. Leptospirosis can be transmitted to humans through the urine of an infected dog, or by touching a wet surface that an infected dog has urinated on. This is where vaccination plays a key role. Regularly vaccinating your dog against leptospirosis can reduce the risk of transmission. Also, try to avoid letting your dog play in or drink from stagnant water sources, as these are potential hotspots for the Leptospira bacteria. In essence, prevention of these bacterial infections boils down to three main points: good hygiene, regular vaccinations, and careful handling of dog waste. Regular hand washing, especially after handling your dog or their waste, is a simple yet effective preventive measure. Keeping up to date with your dog's vaccinations can protect not only them, but also you from potential bacterial infections. And finally, prompt and proper disposal of your dog's waste can help reduce the risk of bacterial contamination. Keep in mind, prevention is better than cure. So let's take these preventive measures seriously for the sake of our furry friends and our own health. Parasites found in dogs can also cause problems. Yes, those pesky little intruders like worms and fleas that take up residence on our furry friends can cause infections in both dogs and humans. Let's delve into this a bit more. Roundworms and hookworms, common parasitic worms in dogs, can potentially infect humans, causing diseases such as toxocariasis and cutaneous larva migrans. Fleas too can jump from your dog to you, causing itchy, irritating bites. So how do we keep these unwelcome guests at bay? It's simpler than you might think. Regular veterinary checkups are essential. Your vet can perform fecal examinations to detect the presence of these parasites and prescribe appropriate deworming medications. Flea prevention treatments are also readily available. Moreover, maintaining your dog's living area clean, properly disposing of dog feces, and not allowing your dog to roam freely in areas where they might pick up parasites are all effective preventive measures. Remember, regular checkups can keep these pesky intruders at bay. Rabies is a serious concern when it comes to diseases transmitted from dogs. This deadly virus, which affects the nervous system, is typically transmitted to humans through a bite from an infected animal. Dogs, however, can also become victims if they have not been vaccinated. The virus travels from the site of the bite to the brain, causing inflammation that can result in symptoms ranging from fever and headache to anxiety, confusion, and even hallucinations. If left untreated, rabies is almost always fatal. The good news is that rabies is preventable. Keeping your dog's rabies vaccinations up to date is a crucial part of prevention. Vaccination not only protects your dog, but also acts as a barrier to prevent the spread of the virus to humans. In addition to vaccination, avoiding contact with unknown animals and seeking immediate medical attention if bitten can also help prevent the spread of rabies. Vaccinations are our best defense against this deadly disease. So, we've covered quite a bit today. We've delved into the risks and precautions associated with diseases that can be transmitted from dogs to humans. It's vital to remember that individuals with weakened immune systems, the elderly and young children, are at a higher risk and should exercise extra caution when interacting with dogs. Dog bites, while not only causing physical injuries, can also lead to infections. It's crucial to clean and disinfect any wounds promptly and seek medical assistance if necessary. We discussed bacterial infections such as campylobacteriosis, which can be contracted through contact with dog feces, and leptospirosis, transmitted through dog urine. Regular hand washing, particularly after contact with dogs, and avoiding contact with contaminated water sources can significantly reduce the risk of these infections. Parasitic infections from worms and fleas can affect both dogs and humans. Regular veterinary checkups and appropriate antiparasitic treatments are necessary to prevent such infections. Lastly, we touched on rabies, a severe disease transmitted through dog bites. Keeping your dog's rabies vaccinations up to date is absolutely essential. In conclusion, the key to prevention lies in regular veterinary care for your dog, maintaining good hygiene practices and promptly addressing any potential issues like dog bites. Remember, living with dogs is generally safe, but it's important to stay informed and take the necessary precautions. Stay safe and keep your furry friends safe too.